Hey everybody, it's Dave. How you all doing? I'm doing pretty good for Thursday. I can't complain. So earlier, I had made a video last week about something about Epsilon. It always pops up, and some people like to comment on my videos about Epsilon, and the video is not even about Epsilon. But somebody commented on one of them, and they were talking about Nurtec, which is Remgepant, but the brand name is Nurtec, and that's what I'm going to use. I'm not going to sit here and look at this and keep going trying to pronounce it. Rembrandtjant, Remgepant. Okay, so I'm just going to call it Nurtec because that's what it is. And the person was saying how Nurtec works 100% of the time for all Meniere's patients and blah 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 blah. And I'm just like, not another one. Another one is going to take shit, throw it against the wall, see if it sticks. Okay. So I decided I was going to look it up, but I was so busy I just didn't think about it until tonight. So I decided to look it up. And the only thing I really found on it was from Swiss Medical Weekly. Okay. I couldn't, and this is from February of 2025. I couldn't find really anything else about it, but it was very interesting and very promising. Now, I will not say it's a 100% thing for Meniere's, because it's not, and it was tested on such a small amount of people. Okay, it wasn't like it was the Epsilon tests where there's hundreds of people being tested and this and that. You get a better idea of how things are going to work when you do that. And it really wasn't tested for Meniere's. It's actually a migraine medication, but I'm going to read it right now, what the summary is, because I'm not going to go through the whole thing. I'll be making a 5-hour video if I did that. In a recent hypothesis states that Meniere's disease is caused by an inappropriate expression, i.e. enhanced release of the neurotransmitter calcitonin gene-related peptide. Here, we tested this hypothesis by administering Nurtec, a new calcitonin gene-related peptide antagonist approved for acute treatment of migraine and prevention of episodic migraines, to 6 patients with both Meniere's disease and migraines. 2 patients received first dose of 75 milligrams Nurtec to treat an acute attack of Meniere's disease. One of these 2 plus the remaining 4 patients were treated with 75 milligrams of Nurtec every other day for secondary prevention. One patient developed an allergic reaction at the first administration. They were excluded. They're gone. Because you don't want to put somebody at risk. Okay. Let's see. Let me see. One patient was treated from further treatment. In the 2 patients treated during acute Meniere's disease, symptoms were relieved and resolved within 30 minutes. That's pretty good. Earlier than the migraine symptoms. While 5 patients had reduced migraine, all completely resolved the Meniere's symptoms on a preventative therapy of Nurtec for up to 8 months. These results support the idea of calcitonin gene-related peptide is linked to the pathogen of Meniere's disease, suggesting inhibition of calcitonin gene-related peptide signaling may represent a promising therapeutic option for Meniere's disease patients. Now, this was just something they happened and did. I couldn't find any real research, clinical trial, or anything for this. But this is what I found. And, okay, so 5 out of 6 patients, it's helped. That's a great number. One was booted because of allergic reaction, but that's a good number. But it's not like I said, it's not like Epsilon where they're doing a clinical trial with hundreds of people. It's only 6 people, and that number's going to drop. Okay, because when you go on Nurtec's website, it says it really only helps. They're only talking about migraine. They're not talking about Meniere's on their website. For migraine, it's 59.3% of the time the medication works within the 2 hours, and then 42% it's after. So it's a start, but it's not even for migraine. So, but Nurtec does not talk about it treating Meniere's disease. But I wanted to get that out because some people will run with it and go, just like AI, let's run with it, it's gospel. Because actually with AI, it's funny when you do the AI search, because I did do that, this is the article that pops up. So I know it's not pulling information from all over the place. So it's probably one of the AI things that I found that actually is the same. So, but like I always do, is I like to see what the side effects are. And I learned that from taking Jardiance. Okay, because that really messed up me. And I'm not going to discuss what happened. I think some of you know. Nurtec may cause serious side effects, including allergic reaction, including trouble breathing, rash can happen after you take Nurtec. This can happen days after you take it. Call your HCP or get to the emergency room for help right away if you have swelling of the face, mouth, tongue, throat, trouble breathing, or rash. This occurs in less than 1% of the patients treated with Nurtec. High blood pressure can worsen or occur after taking Nurtec. Call your HCP if you have an increased blood pressure that I will not be taking, will not be trying because I am not increasing my blood pressure. It's high enough as it is. And circulation problem called Raynaud's phenomenon. I always thought it was a syndrome, but okay. Can worsen or occur after taking Nurtec and can lead to your fingers and toes feeling numb, cool, painful, or changing color from pale to blue to red. Contact your doctor if that happens. So these are things that I would not, I look at and right from the start, because of me with blood pressure problems, no. And believe me, just because I've had these surgeries, I still get the symptoms. I don't get vertigo, but I get everything else. Right. Safety profile, Nurtec was extensively studied in clinical trials. Acute treatment of migraine with or without aura in a study of 682 patients. This is just migraine. It is not Meniere's disease. Nausea. 2% of the people who took Nurtec versus 0.4% who took a placebo. Preventative treatment, this was the 370 patients, just migraines. Nausea, 2.7%. It's almost the same number. Indigestion, stomach pain, 2.4%. People who took Nurtec. These are not all the possible side effects of Nurtec. Talk to your healthcare provider about any other side effects. With Nurtec, I take medication to get rid of my migraine pain without making me drowsy. Awesome. So, where does this lead us to with Nurtec? So far, if you've got vestibular migraine or migraine, Nurtec is probably one of the best meds to take. As far as Meniere's disease goes, there's just those 6 people that they talk about. So I really wouldn't put it in a bucket where, it's going to help Meniere's disease for 100% of the people. It probably isn't. So, when you see people talking about that, this is what I talk about. You got to do your research. Because somebody will see that and go, this guy says it's 100% effective, and run out and take it. And the next thing you know, run out and talk to your doctor into giving it to you to try for Meniere's disease. Because let's face it, some doctors are willing to do that. And the next thing you know, you're in the emergency room, covered from head to toe with hives and going like this. And I made myself cough doing that. So, you really got to weigh your options here. I mean, personally, just for me, just from the blood pressure part, I won't take it. But, you know what? It may help you. It may be something you want to talk to your doctor about. If at least for a rescue med, that would be an awesome rescue med. Imagine taking something that could stop everything in a couple of hours. That would be awesome. That would be awesome. So maybe for a rescue med, maybe might want to give it a shot. But as far as an overall thing, I would look for more studies. I would see if there's studies on this, because I don't think there is. And I know there's people that are talking about genetics and all this stuff. So let's just go from there, and I will talk to you all later. Have a great night. Bye. Sorry about my grandson. Have a good night.